I'm Dr. Michael Swan, a gastroenterologist at the Victorian Gastroenterology Group and head of endoscopy at Monash Health. Bowel cancer is one of the most common cancers in Australia, but it's also one of the most preventable. In this video, we're going to talk about why screening matters, what the process involves, how we assess risk, and what happens if something is found. Whether you've received a positive stool test result, have a family history of bowel cancer, or have simply been meaning to get checked, I hope this gives you a clear and reassuring picture of what to expect. So what is bowel cancer? Well, bowel cancer, also called colorectal cancer, typically develops slowly from small benign growths called polyps, which form in the lining of the bowel. This slow progression is actually what makes screening so powerful. If we can find and remove these polyps before they have a chance to become cancerous, we can prevent bowel cancer altogether. And even if cancer is detected early, the outcomes are significantly better. Bowel cancer caught in early stage has a survival rate of over 90%. The challenge is that polyps and even early bowel cancer rarely cause symptoms, which is exactly why screening matters, even when you're feeling completely well. So even while early bowel cancer and polyps often causes no symptoms, there are warning signs that should always prompt a visit to your GP or specialist. These include a persistent change in your bowel habit, whether it be constipation or diarrhea, blood in the stools or blood from the bowels, unexplained weight loss, abdominal pain or bloating, or even just fatigue for some unknown reason. If you notice any of these symptoms, please don't put it off. In most cases, there will be a benign explanation, but these symptoms always warrant assessment, and earlier is always better. It's also worth thinking about your family history. Having a first-degree relative, a sibling, a parent, or even a child who has bowel cancer or significant polyps will increase your own risk. You may be eligible for screening earlier or more frequently than the general population. There are a few ways we can assess bowel cancer risk and investigate symptoms. The first is a fecal occult blood test, or FOBT, or sometimes also known as a bowel cancer screening kit. This is a simple test that you can do at home that detects microscopic amounts of blood that you can't even see. In Australia, this test is sent free to people over the age of 50 through the National Bowel Cancer Screening Program. If the FOB test is positive, it doesn't mean bowel cancer. It simply means that we need to have a closer look. The gold standard of investigating the colon and assessing for polyps and early bowel cancer is a colonoscopy. This is a procedure where a thin, flexible camera is used to examine the entire length of your large bowel. It's performed under light sedation, so you're comfortable throughout, and most patients have no memory of the procedure. The colonoscopy procedure itself usually only takes 20 to 30 minutes, and if any polyps are found, we can often remove them during the same procedure safely and without the need for any separate other operations. If a polyp requires further analysis or there are any findings that need following up, this will be discussed with you by either your GP or your gastroenterologist. Most findings at colonoscopy are benign, and even when further treatment is needed, catching things early means the options are far less invasive than if we left them undetected. For most patients who have a clear colonoscopy, or even those with only several small polyps, a follow-up colonoscopy in 5 to 10 years is all that's needed. You will receive a personalised recommendation based upon your findings and risks. So in closing, bowel cancer is largely preventable, and that's genuinely good news. If you've been putting off getting checked, let this be a nudge in the right direction. The process is much more straightforward and much more comfortable than most people expect. If you've had a positive FOBT result, have a family history, or have noticed any symptoms, or simply just haven't been meaning to act, please speak to your GP about an early referral, because early action really does make a difference.